Hello, this is Dr. Maha from Medela Medical Videos and Podcast. And today will be the first part of a series that I'm going to talk about different vitamin deficiencies and essential element deficiencies. Now, the four most common vitamin deficiencies that are seen on a daily basis is vitamin D, vitamin B6, vitamin B12, folic acid, and many important essential nutrients and minerals such as iron deficiency, calcium, magnesium, zinc, iodine, and many other more that we will be talking about in another episodes. Vitamin D is a fat-soluble vitamin that helps regulate the amount of calcium and phosphate in our body, which are needed for healthy teeth, bone, and muscles. The mechanism of action is that vitamin D stimulates the absorption of calcium and phosphate from the intestine and the reabsorption from the renal tubules. The vitamin is then metabolized in the liver and excreted in the urine. So vitamin D is important to help keep your body functioning well, not only with the strong bones. It is very beneficial to the immune system of the body, as well as it helps with the high blood pressure, heart disease, diabetes, with infections. The most common causes of vitamin D deficiency is the insufficient amounts of vitamin D in our diet, as well as the inadequate exposure to sun. The other causes could be malabsorption, as seen in certain diseases with cystic fibrosis, celiac disease, and weight loss surgeries that will reduce the size of the stomach or bypass the small intestine, or accelerated catabolism by certain medications as anti-epileptic medications, and in chronic kidney and liver disease in which there will be lack of the enzyme that will lead to inadequate amounts of the active form of the vitamin D. Signs and symptoms of vitamin D deficiency. In adults, the signs and symptoms are not very obvious. The patient might come complaining of chronic muscle pain, bone pain, mood changes such as depression, in extensive cases, osteomalacia, in which there is poor mineralization of the bone matrix. In children, they are often found to have started walking late or sit for prolonged periods of time, or it can lead to rickets, in which the obvious findings are forehead protrusion, enlarged head, depressed ribs, pigeon chest, protruding abdomen, kyphosis, the bowing of the legs, enlarged epiphysis of the wrists and the ankle, as the growth plates have not been fused. The examination can reveal periosteal bone pain. Vitamin D deficiency increases the risk of osteoporosis. Sources of vitamin D in our diet are oily fish, such as salmon and bluefish, liver, red meat, egg yolks, and fortified milk and dairy products. Another very good source of vitamin D is the sun. Now, getting exposed to the ultraviolet B radiation, outdoor exposure of the face, of the hands, back of the hands and the back and the legs for about 15 to 20 minutes, 3 times a week, between 10 a.m. and 3 p.m. has shown good results of vitamin D production in our skin, the active form. And obviously, this depends upon many factors such as the country you live in and the melanin content of your skin. The darker your skin, the more sun exposure you will need. Supplements. Supplements can be customized according to the age of the patient and the requirements. Now, generally speaking, the Endocrine Society recommends 1,500 to 2,000 international units of vitamin D supplement to all men and women older than 18. Now let's be more specific according to the age-wise. Infants 0 to 6 months, the recommended dietary allowance is 400 international units with an upper level of 1,000 international unit per day. And in infants 6 months to 12 months, the recommended dietary allowance is 400 international units with an upper level up to 1,500 international units. Children 1 to 3 years, the recommended dietary allowance is 600 international unit with an upper level of 2,500 international units per day. Children 4 to 8 years of age, the recommended dietary allowance is 600 international units with an upper level of 3,000 international units per day. People 9 to 70 years of age is 600 international units with an upper level of 4,000 international units per day. Whereas people 70 plus can take from 800 to 4,000 international units per day. Females aged 14 to 50 years of age, either they are pregnant or lactating, must take 600 to 4,000 international units of vitamin D daily. Vitamin D toxicity is very rare, and if it happens, it can lead to hypercalcemia. The symptoms are nausea, loss of appetite, increase in thirst, increase in urination, constipation, ataxia, confusion, and weakness. Now let's talk about the labs of vitamin D. We usually ask for serum 25-hydroxyvitamin D. Less than 30 nanograms per milliliter is considered insufficient. Less than 15 to 20 nanograms per ml is used to define vitamin D deficiency. And not to forget that there is an inverse relationship between the parathyroid hormone PTH and the 25-hydroxy vitamin D level. Patients with vitamin D insufficiency often have corresponding elevation of the PTH hormone that can be corrected once the vitamin D is corrected. Now, patients with vitamin D deficiency can be treated either with tablets or IM injections or oral injections that can be given daily or on weekly basis. The main thing is to not forget giving them a maintenance dose once their deficiency have been corrected. These are the most important points you need to know about vitamin D. See you in another episode.